Hi, beautiful Preggy. You are almost there. Weeks away from you holding your baby in your arms. But the third trimester is no joke. From sleepless nights to powerful kicks. Let us talk about the third trimester, the symptoms and the sign that you're going to notice in your third trimester. Hi, beautiful people. Welcome back. My name is Daisy Peter, a content creator based in Port Harcourt. I'm a mother of three beautiful kids. All I do here is talk about pregnancy tips, motherhood experience. And mind you, my teachings are based on purely from my personal experience and based on research. You can still consult your medical doctors. Let us dive into today's topic. The symptoms, the signs, what you will notice in your third trimester. So let us talk about what is third trimester. What is third trimester? The third trimester ranges from week 28 to 40 weeks or until you give birth. A lot of people give birth at week 41 or even 42. So in the third trimester, your baby is now rapidly growing and your baby is ready to live without you, to not stay outside of the womb. So you might start feeling the stronger kicks, the pressure, the pelvic pain, and then frequent urination. So now, these are the common symptoms that you should experience in your third trimester. When you see these signs, just know that you are already in your last lap of your pregnancy journey. So look out for these signs. Once you see them, know that you're in the final race. Number one is back pain and pelvic pressure. You start noticing a heavy back pain and the pressure in the pelvic will be so severe because at that point the baby has already engaged, the head is already down, is trying to look for a way to come out. So you will now notice that the pain in your pelvic will become more intense. Number two symptoms in this third trimester is shortness of breath. Every time you see yourself always yes, this is because your baby is now trying to push its way around your diaphragm. Number three symptoms is swelling of your ankles and your feet. Yes, in this third trimester, especially when you sit down for a very long time, you start noticing swelling of your legs. Some people confuse this to be edema. It might not necessarily be edema, but in your last trimester, you now see that your leg is not swollen. So most time when you notice that your leg is swollen, it could be that you've sat down in a particular spot for a very long time. You might as well lie down so I can reduce the swelling of your feet. Another symptoms to look at for in your third trimester is fatigue and insomnia. Yes, you will find out that in that last trimester, you might not even see yourself sleeping again. Every time you're always awake. And then finally, that frequent urination. Every now and then you're going to the toilet. And this can be very frustrating because most time you'll be pressed to the extent that you feel if you don't get up, you will defecate or urinate on your body, only for you to go to the toilet and you find out that nothing is coming out. So all these are the symptoms and the signs that you should be looking out for or you will expect in your third trimester. So now that we've known what is third trimester, the symptoms and the sign, let us now talk about your baby's development in the third trimester, how your baby is growing in this last lapse of your pregnancy journey. So in your third trimester, your baby is going through amazing changes. So as by week 32, most babies are already engaged, meaning their head is now that they've turned their head because they are preparing to live outside the womb. They are preparing to live without you. So from these 32 weeks, the lungs, the brains, the organ are now maturing, are now developing rapidly. Then you will now notice more frequent kicks. Your baby will start kicking frequently and the kicking will be very noticed. That is a sign to show you that your baby is very active and very healthy. So in this time too, if you don't really notice, if you stay for a whole day, you don't notice your baby kick, please call your doctor, go to the hospital, do not hesitate. There are cases of when mothers did not notice their baby kick, they just took it like it's not serious. By the time they go to hospital, they stay for like 2 3 days. By the time they go to the hospital, it was discovered that they already have a dead baby inside of them. So once you notice it from these 32 weeks, if you stay for a whole day, your baby does not kick, please raise an alarm so that it will not be in case of emergency. So we basically have talked about the third trimester, what it's all about, the symptoms, the signs you should be expecting, your baby's growth and the milestones. Now let's talk about the healthy tips that you should take into consideration when you're in your third trimester. Take these healthy tips very important, because you need to give birth to a healthy baby and a baby that is alive. So take down the following healthy tips. Start preparing your hospital bag or your delivery bag. There are some people that at 32, 33, 34, they are not even ready. No, you should be ready by this time, because nobody knows when labor will start. Labor might come from 37 weeks. From 37 weeks, anything can happen. So from your third, once you enter your third trimester, just start packing your hospital bag, arrange everything. The hospital list they gave you, make sure that everything is complete. Pack your bag and keep them ready. Another tips is continue going for your prenatal visit. Even though you're in your third, in the last trimester, it doesn't mean that you've given birth. Continue to visit your doctor, because they will still continue with the scan, checking your body to know if your baby is breathing well, the weight of your baby and all that. So do not miss your prenatal visit, because you're already in your third trimester. It's a journey you've started from the beginning, and now that you're in the last phase, do not relent. Make sure you finish your prenatal visits. Number 3 is finalize your birth plan. Number 4, continue in your light little exercise as a pregnant woman. Yes, it will help you a lot. I already talked about the types of exercise that is good for you and the importance of exercise. If you haven't watched that video, I will drop the link in the description box. You can go ahead and watch it to see the importance of exercise when you're pregnant, and what it can also cause if you don't engage in all this exercise when you're pregnant. And lastly, please do not travel to long distances anymore. Always make sure you're always within the hospital, within the within, always make sure that you're within the area that when it is time, it will not be an emergency case, you can quickly enter the hospital. So this is a pro is a bonus tips I'm giving you. Don't travel to long distances again when you're already in your third trimester, when you're already close to the due time. So now that you've known the tips, the healthy precautions you should take in your third trimester, and you know that this third trimester is the time you are now preparing for your baby. So we are going to now talk about when you should call your doctor, when you should call your doctor. What are the signs, the things you will notice for you not to be worried in this third trimester? Number 1 is if you have regular contraction that does not go away. If you're a new mom here, you're wondering what contraction is. Contraction means when I was in the late man. I told you that I'm not a medical doctor, so I use it in the time that I understand. When the womb is trying to contrast, then release itself, it holds and releases itself. That's contraction. Just the way menstrual pain will hold you, but this is a kind of somehow bigger than menstrual pain. It will tighten, it will loosen, it will tighten, it will loosen. So when this continues persistently non-stop, then call your doctor. Another sign that you should call your doctor is when there is fluid leakage or your water breaks. The water sacs that hold your baby in the womb, when it's almost time for you to deliver, is going to break. You will just sit down somewhere and you feel like somebody poured you water or you urinated on your body. When you notice this, just know that it is one of the signs. So quickly call your doctor. Your doctor will tell you what to do. Another sign for you to look at is when there is heavy bleeding. You notice that they're already bleeding, and then the baby movement now keeps moving faster than it used to be, is another sign. These signs I just mentioned are the major signs for you to know that labor is near. The water leakage, bleeding, movement of baby, contraction. When you notice any of these signs, just know that labor is near. So these are basically the few things that you should be expecting in your third trimester. Yeah, the third trimester is the last phase of the journey, the preparation from month 1, 2, 3 till the ninth month. And remember, don't worry about the third trimester, because it's going to be a walk over if you put into place all that I've taught you in the first trimester, the second trimester. The third trimester is going to be a walk over for you. God's willing, you're going to give birth to your baby. And another thing I want to tell you is that the month of delivery, the weeks of delivery varies. Like me, for instance, I gave birth to my first daughter at week 37. I gave birth to my second daughter at week 40, and I gave birth to my third daughter at week 41 thereabout. So I was using my first daughter's week of delivery to judge my second daughter's one, that every now and then I'll be going to the hospital when I clocked week 47, that it is time. No, that you gave birth in week 37 in your first pregnancy does not mean that same week you give birth in your. So just calm down until you notice the signs that I just gave you. Do not worry, do not panic. When it is the appointed time, you will notice the sign that I just mentioned: the water leakage, consistent contraction, kicking of the baby, bleeding and all this. So these are the time that you should be worried, and then call your doctor, and your doctor will tell you what to do. So if this video helped you to understand the third so if this video helped you to understand the third trimester better, please don't forget to give it a thumbs up, comment, and share for other beautiful mothers who are also joining in their third trimester, so that they will learn one or two from this video. Bye, and see you in my next one. Thanks for watching. Bye.